talking about how to treat headaches, muscle tension, etc., in blood deficiency where a massage or needling that included Asher work made them worse, not better. The first thing we want to understand is that our touch is going to be very different. So no matter what my first touch, I'm going to be checking to see what's in here. I'm going to come in, I'm going to see how that divot. And for her, the first thing I noticed is that as I come in, it drops very easily. So I didn't hit a lump or hump, okay? So right there, that tells you that for this particular person, any headache or blood deficiency is because it's sunk towards in, not been pushed out, okay? But that's just to know because we're on this person. So I'm going to be checking in and I'm going to be getting some information. But as I go and I'm checking where the vertebrae are, all right, seeing coming through, checking in here, and I'm going to check the usual culprits, which is going to be that Genjing area. I'm going to be checking this area right here around Dajue to see if there's tension. I'm going to be, my eyeballs are looking here and here as well as alignment to see whether or not we're going to find crunchies, and then are those crunchies relevant, and are they a beaver dam that has to be released so flow can return, or are they an accumulation due to lack of innervation? Ooh, that's a sentence right there. Accumulation due to lack of innervation. In which case, going after the beaver dam means you're making more debris, not less, okay? So I want to take in that information. I'm going to check that Sanjiao line here because while it's not often, when it is the cause for a headache, nothing else is going to solve the problem. And I've talked about that in a lot of places. So I'm going to come across and I'll have already made some decisions, but no matter what, in this particular person, I've read the room, I've looked at the tongue and the pulse, I've got the information that my touch, it's going in and it's lifting and then letting the blood go. Lifting and then letting the blood go. It's not going in, 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 oh, yeah, right? So I don't want to end with the squish because if you picture a sponge, you squish it and the sponge doesn't have what it takes to go back out. So I need to help that sponge let everything go. So my touch is going to be a very different, and it's going to look the same. I'm massaging the neck, but someone else is going to come in and start doing this stuff. Whereas here, and then it always emphasizes the exit out. The exit out. Ooh, help the blood go. And so it's like you're taking something and you're going, and now spread. And now spread. All right? So I'm not trying to squeeze everything out of that sponge. I'm actually trying to get everything loose and flow. And so from the outside, my hand is going to look like I'm rubbing the shoulder blade, but the difference between this and, oh, there's an Asher. Oh, there's an Asher. Oh, let's get that. Both are going to look somewhat the same if we don't know what we're looking at, but one is, it's very different. I'm assuming, yeah? Yeah. Right? Doing it right is good. The other one gives her a headache. And it's it's the difference of how did I spread and finish? Spread and finish. Spread and finish. Spread and finish. So that's the first thing, is that the touch is completely different. Ooh, ooh, ooh. It's not focused on finding the nasties. I'll discover the nasties, and if I find them, I may have to let some of them go. The next thing to know is that it'll be most likely at the end of the treatment, but anybody who has that blood deficiency and has headaches is, I definitely need to finish or consider finishing with nice scalp work. Okay? So important. And again, it can't be, again, it has to have like that, ah, ah, ah. So that's going to be later on to help. And then in a perfect world, I have time to have them supine and I would do gentle scraping across the forehead. And I would not go, oh, yes, let's get those spots. Sometimes that's critical. Not in this case, because you do all that work and then you hit that and everything's going to go wrong. Think about it where blood deficiency, everything is going to go gravity to a pain spot. Whereas in a person like me, it's going to push everything away from the pain spot, right? It's just a question of chi and blood. So that's the first thing that we have to track.